Hello dearie, how are you doing? I hope you're doing wonderfully well. In today's video, we are going to take a look at registered mental health nurses. This is the second part of my series on the types of nurses that we have in Ghana. And today we'll look at mental health nurses, who they are, what they do, how you become one, and the opportunities and benefits of being a mental health nurse. Okay, so if you've been wondering who a mental health nurse is, you've been hearing of this group of nurses, but you don't know what it's all about, then this is the video for you. Let's dive right in and discuss. So a mental health nurse is a nurse who specializes in caring for people with mental health issues. They work with patients and their families to assess, diagnose, treat, and support mental health conditions. It's one of the highly specialized basic programs that we have. It's like when you decide to become a mental health nurse, you are like choosing a specialty from the get-go, and your career progression might be around mental health unless you opt out of the profession, like unless you decide, I'm done with mental health, I don't want to do mental health again, then you can find another alternative. But from the get-go, mental health nurses are highly specialized. Their field is specialized. It's mental health conditions, people with mental illness, community engagement on mental health, and all of that. And see, so it's mental health all around. So what do they do as nurses? In the clinical setting, that is in the hospital where mentally ill people go, they function as the nurse who takes care of the sick, like the physically ill, but in this case, for the mentally ill. So they are nursing the mentally ill who may not be physically ill. It's your mind that is doing its thing, but the body, the physical body is fine. So most of their work is around screening and evaluation. They do a lot of assessments. They work with various teams that will come together to take care of these patients. They do education on conditions. Mental health lasts for a long period of time. Sometimes once the person starts manifesting these symptoms, it may be for the rest of that person's life, and so you need the family on board. So they educate the family on the condition, how to take care of the patients, because mental health patients are not always hospitalized or institutionalized. They have to go home, and the families have to know how to take care of them in their home. And they also go out into the community to educate communities, create awareness on mental health, and all of that. They organize community programs, practicing crisis interventions and case management. So when we look at mental health nurses, the other cadres of nursing, let's say general nursing, like general nurses are part of a team. The doctor is the head, and they decide the plan of action, and then the nurse will execute some of those plans. But when it comes to mental health nursing, it's like they are at the center of that team, okay? They spend the most time with the patients. They do the most of the assessments and relay information to the psychologist or the psychiatrist on duty. It's like they run the team. Let me put it that way. So they run the team when it comes to mental cases, or when it comes to case management. They link everybody together to whatever the patient will need. The good thing about our nursing training here in Ghana is that you have experience in all of the specialties before you graduate. So definitely, even if you are doing nurse assistant clinical, if you are doing general nursing, midwifery, nurse assistant preventive, or public health, you will still do your mental health affiliation, and you'll understand what I mean by mental health nurses they have first-hand control when it comes to case management. So that is what they do in a nutshell. It expands more than that, but in a nutshell, that's what they do. Now, how do you become a registered mental nurse? So we have two programs. We have the diploma program and the degree. The entry requirements are the same for both, but at the university level, if you want to do the degree, then you may have to meet the cutoff grade for their regular program. If not, you can apply for the fee paying program. It's the same requirement for the other nursing programs: A1 to C6 in your English, Maths, and Science, and A1 to C6 in any 3 accepted elective subjects. When it comes to schools, this program runs in very few schools. Just 3 schools run the diploma program. That's the Ankafo Nurses Training College, Antine Nursing and Midwifery Training College, and College of Health Sciences, END. They are the 3 schools that offer the diploma program. If you want to do the degree program, then you have to go to Legon, that's the University of Ghana, the University of Cape Coast, UCC, or Valley View University. And Valley View is a private university. So 2 state schools and 1 private school offers this program. The caveat here is, if you want to do your program at the University of Cape Coast, then you need to be a general science student. They do not accept any other program aside general science. So if you are not a general science student and you want to do the degree, then you should be looking at Legon or Valley View University. Now, where can they work? Registered mental nurses can work in all facilities except for chief zones. They work in the mental health unit of every hospital and clinic. Most health centers have a mental health unit, and that is where you find the mental health nurses. You hardly find psychiatrists or psychologists at the lower levels, and so it's the mental health nurses that do the diagnosis, prescribe medication, and do all of the follow-ups, unless maybe it's something beyond them that they have to refer. And so to a large extent, they are autonomous. They work on their own, just under the supervision of the medical soup. They can also work with NGOs that are focused on mental health. They can work in schools, they can work in rehabilitation centers, and in the communities. They organize programs in the community. And I should also add here that we have 2 programs. We have the registered mental nursing program, and we have registered community mental health nursing program. So the 2 of them do similar things. It's just that the registered community mental health nurse has a lot more community engagement than the registered mental health nurse. But if they are in the same unit, they will do virtually the same thing. Okay. These 2 programs, the registered mental health nursing program and the registered community mental nursing program, are nursing programs, and they are different from the community mental health program. If you go and do community mental health in a school like Kintampo, the College of Health Kintampo, the College of Health Yamfo, UHAS, and the other schools, you will come out as a community mental health officer, not a community mental health nurse or a registered mental health nurse. Any program that does not have nursing attached to it is an officer program, or is a public health program that is not focusing on nursing care. So if you want to be a nurse, then it's either RMN or RCMN. So that's about where they work and the differences. I just wanted to chip in there. Now, what are some of the benefits of being a registered mental nurse? Mental health has gained a lot of traction in recent years. And so having a qualification in mental health gives you opportunity to a lot of avenues. You can work with various groups of people. In fact, in this country, even though mental health nurses are few, the people who travel easily and sometimes with sponsorship out of this country are mental health nurses. In fact, I've seen it really gadochi. Some nurses, general nurses, public health nurses, midwives will be paying huge sums of money to travel out of this country, and a mental health nurse will just do all those things for free. Like somebody is heavily sponsoring them to go outside. And you also have opportunities to specialize even more and zone in on different aspects of mental health, because mental health is broad. Okay, we have different stages of mental health conditions. that at different ages that you can specialize on. So for example, if you go to the Ghana College of Nurses and Midwives, you can do additions nursing, child and adolescent mental health nursing, community mental health and rehabilitation nursing, and they have a lot more. Like outside the country, there are a lot more programs concerning mental health that a mental health nurse is entitled to or is eligible for. Even though they are specialized from the get-go, their career advancement is not a problem at all. And working autonomously is one thing that you just cannot beat. Okay, be working as your own boss is sweet too. It's sweet. Even though you answer to somebody, there's nobody breathing down your neck every 2 seconds to do this and do that and do that. Okay, so yeah, I really like that aspect of mental health nurses. They work on their own. Like, yeah. Okay, so that's a little I wanted you to know about registered mental health nurses. It goes deeper than this, and you can do more research to explore and see if you'll be interested in this program. If you're someone who is drawn to the issues of mental health, this is a great career path to take and advance and have a fulfilling career. Okay, so I hope this video was helpful. The first part of this series, we spoke about registered general nurses. If you're interested to know who registered general nurses are, you can click on this video next, and I'll see you there. Bye.